Welcome back. If you've just joined us, you're watching the news at 10 on Channels Television, coming to you live from Lagos. A reminder of our top stories. Confirmed COVID-19 cases in Nigeria on the rise as the Nigeria Center for Disease Control puts the total number of patients at 174 after additional 35 persons tested positive for the virus today. President Buhari approves distribution of 70,000 metric tons of grain from the National Strategic Reserve to vulnerable Nigerians to cushion the impacts of COVID-19. Federal government begins advance payments of 20,000 naira to indigent Nigerians under the Conditional Cash Transfer Scheme as part of its COVID-19 response strategy. And UN warns COVID-19 outbreak could bring a recession with no parallel in recent history, describes pandemic as the biggest challenge for the world since World War II. Plus, we'll have business, sports, news from Abuja, the FCT, and later international news from our studios in London. Our website, channelstv.com, has more information on our top stories and others. Do subscribe and watch Channels Television's live stream on YouTube and other social media platforms using your mobile device browser. Or you can download the Channels TV app for Android and iOS devices from their respective stores. You can also watch us via your smart TV platforms on Apple TV, Android, Fire, and Roku as well. Now let's get a bit more perspective, particularly from the team in the forefront of managing this health crisis. I'm being joined live from Abuja by the National Coordinator, Presidential Task Force Team on COVID-19, Dr. Sani Aliyu. Thanks a lot for joining us on what's been quite a long day for you. Thanks for coming in.
Thank you for having me.
Now, each time there's a formal confirmation of new cases, it troubles a lot of people. Is it that the capacity for testing has improved, or are you seeing an influx of people presenting with COVID symptoms?
Well, it's really the nature of the epidemic. If you look at the epidemic curve from other countries as well, when cases start rising, they usually rise exponentially. It's not like you have an increase by single digits. Usually one person will infect between 2 to 3 people on average. So within a week, really, you can have a doubling of the figures. At the same time, you're also right. We're definitely testing a lot more. The NCDC has really ramped up testing. They've opened about 2 labs, additional 2 labs so far compared to the 5 labs we had last week. Their capacity has increased. We're looking really at going to up to 1,000 tests, hopefully by the end of this week. So it's a mixture. But at the same time, we're also doing a lot more contact tracing because the more cases you have, the more contacts you need to follow up and chase for symptoms and then to test them. So for instance, I think at the moment there are about 5,000 persons that are being contact traced based on the numbers we have. And that's going to increase significantly over the next few days as more and more cases come up.
And in terms of the length of time it takes to get a result, are you seeing a shortening of the timing? You know, how long does it take now, on average, to get a result out?
So I'll have to leave the exact figures to the NCDC, but certainly we've noticed an improvement in the turnaround time. We've also, the NCDC has also opened test centers, sort of drive-in test centers in Abuja and I believe in Lagos, and possibly there's some work going on in Kano as well. This has significantly improved the turnaround. On average, the test itself takes about 6 to 8 hours to run on the PCR machine, and then you have to validate it. About 30% of the tests fail. And they have to be repeated again for various reasons to do with controls, etc. So sometimes that's why we tend to have delays of up to 24, sometimes even longer. But we are doing everything we can to make sure that the tests are more efficient. The Presidential Task Force has been looking at performance indicators, including the number of tests that are done, the number of people that are still awaiting tests, and how long it's taking.
All right. Yeah. At today's briefing, we heard a bit more about the lockdown and how it's going to be enforced. Just in terms of giving the NCDC and other partner agencies space to work, that was the whole idea. How long do you think it'll take to begin to see a change in the curve? I know flattening the curve is what everybody seems to be saying, but How long do you think it'll take for us to begin to see a change from the current trend of the spread?
So, of course, I can't predict that because being an epidemic, that's why it's called a pandemic. It's a difficult one, but usually things usually tend to turn within 3-4 a week after closure. The main reason why we actually went for the restrictions, as you rightly said, is to enable us get on top of the contacts that we need to trace, and at the same time reduce ongoing transmission. Because if you have fewer people interacting, fewer people coming out and relating with each other, you're not going to get transmission. The virus itself does not fly. You need contact between two persons in order for the virus to transmit. So if people keep away from each other as much as possible, stay at home. Keep your social distances, avoid mass gatherings. The virus itself will just better out. So that's why we went for the restriction measures. But as you can see from what's happening in other parts of the world, it's definitely a very infectious condition. It's also very different to what we have seen in the past with other respiratory viruses such as influenza. The mortality, the death rate is also relatively high, particularly in certain groups like the elderly, those with underlying medical conditions. But the vast majority of people will probably have a mild to moderate illness. Up to 80% will have a mild to moderate illness and may not even notice those symptoms. And they're the ones that could go on to transmit to more and more people within the population. So yes, we are measuring as many tests as we can, but the important thing is to try and break the transmission by stopping people from interacting closely with each other.
All right, National Coordinator, Presidential Task Force Team on COVID-19, Dr. Sani Aliyu. Thanks a lot for joining us on the News at 10 tonight.
Thank you very much.
Right, let's cross over to Abuja now, and here's my colleague Linda Akigbe. Linda.
Hello, Ijoma. Now, the Minister of Environment, Mohammed Abubakar, has flagged off a nationwide decontamination exercise in public places to contain the spread of COVID-19. The minister explains that the move has become imperative following the spread of the virus. Men of the Federal Fire Service receiving instructions on how to go about the decontamination of public places as the cases of COVID-19 surge in the country. As at April the 1st, the total number of confirmed cases of those living with the virus is 151. But the federal government is going all out to ensure that the spread of the disease is contained.
This is a collaboration between these two ministries or agencies, the Federal Ministry of Environment, Interior, specifically the Federal Fire Service. They have the equipment, as the fire trucks that we can use to dispense the chemicals, to decontaminate, disinfect. The Federal Ministry has the expertise where we have the environmental health officers, registered environmental professionals that know how to mix the chemicals and disinfect. This is something that will start here, but intend to disinfect all danger-prone zones, we call them. There are areas that we may not need to decontaminate or disinfect, but the immediate areas are places, like motor parks, like markets, places like that, government establishments. These are all areas where there is a concentration of a lot of people, so we need to decontaminate that.
Officials of the Environmental Enforcement Agency speak on the composition of chemicals to be used.
WHO recommended and also has the property of being user-friendly to the personnel and also environmental-friendly. So it has no or less effect.
The exercise is expected to commence immediately in the Federal Capital Territory, Ogun and Oyo State. This is expected to contain the spread of the virus. In Ebonyi State, Governor Dave Umahi says 8 persons suspected to have been infected with coronavirus in the state have tested negative. The governor explains that the state government has completed a state-of-the-art COVID-19 center for testing of cases of the virus, while directing the closure of all borders, ban on religious gatherings, burial and wedding ceremonies, as well as operation of restaurants and bars across the state. The governor says observation centers have been established in 6 locations across the state.
The Ishielu Quarantine Center is about 10 rooms. The 2 quarantine centers in Unity Square, each is about 10 rooms. They are fully ready. We are working on the 3rd one. This we started in January this year. And I'm happy we started on time. We have also yesterday gone ahead to prepare 6 general hospitals. To further prepare, we chose 2 per zone. Now, our testing center for COVID-19 is now ready in Ebonyi State. The installation was completed last night. That is the 7th COVID-19 testing center. We have ordered churches and mosques, nightclubs, schools, drinking parlors to close down. Any church or mosque or nightclub or school or drinking parlor that defies this order will be acquired by government. The government will acquire the property immediately and then arrest whoever that is in charge there. So let us play safe and be prayerful.
Meanwhile, Enugu State government is monitoring the enforcement of a total lockdown order issued in the state to contain the spread of coronavirus. The state government had on March the 28th confirmed 2 cases of coronavirus involving a returning couple from the UK who are currently being treated. Governor Ifeanyi Ugwuanyi was out today at the markets and malls in the company of security operatives to monitor compliance levels and encourage those who came out to go home until it's safe again to come out. This is coming 24 hours after the closure of all land borders and markets across the state, exempting those who deal with food, pharmaceutical and other basic life essentials.